Hi, my name is Niko, and I'm so excited to share with you how Redox will improve healthcare. I used to work at Epic, a leading electronic health record company, where I had a front row seat to the digitization of healthcare. We saw rooms of files replaced with rooms of servers, and computers were installed in every exam room across the country. A few behemoth EHR vendors now hold the vast majority of medical records today. But what did we get for the billions of dollars we invested in moving to EHRs? The healthcare industry is decades behind the efficiency gains that computers and the internet brought nearly every other industry. And it's estimated that 1/3 of healthcare spending is wasted. The problem is, the solutions best designed to meet these needs are built in the cloud, and EHRs live in the basements. For an application to actually work with one of these health systems, they have to build a point-to-point integration with each health system they work with. This requires them to work within closed systems that were never designed to interoperate. This ends up costing them around $30,000 per health system they work with. And for each of these applications, this creates a huge technical barrier to health IT innovation. All told, $3 billion is spent on these interfaces that are really one-time use. That's where Redox comes in. We centralize these efforts by transmitting and translating data from legacy EHR systems to cloud-based applications through the use of an application programming interface, or API. A new application can hook up to us in a matter of minutes and securely connect to develop an integration strategy based on our development tools and data models. We meet health systems where they are by allowing them to leverage their EHR investments. We work with their existing infrastructure and give them a clear path to the cloud. They're able to adopt cloud-based technologies at whatever pace makes sense for them. When a new vendor wants to work with us, we set them up on a developer account. For $30 a month, they can access the development tools and create an integrated strategy that they can go to a health system with. Once the health system is ready to buy their product, Redox manages the implementation process and sets up the connection between the health system and our cloud. Beyond the health systems that applications bring into the network, they also have turnkey access to integrate at all of the other prior health systems on our network. And the health systems are excited about this too. They see the more than 60 applications on our platform as a marketplace of tools that they can turn on without the risk of a costly implementation process. We've onboarded applications from startups all the way to Fortune 500 companies and publicly traded companies. For instance, we've recently been selected as the key integration partner to Salesforce, who announced in November that moving into healthcare was their next billion-dollar idea. We've also learned that health systems are developing applications on their own as well. And when they hear about the functionality that we provide, they can't wait to get their hands on it. The race to interoperability is as much about execution as it is about the technology. And our team is well positioned to meet those needs. I met James at Epic while he worked for 6 years on an odyssey through nearly all of Epic's technical teams. He helped develop some of their core interoperability functionality, as well as worked with some of the key academic medical institutions. Beyond his work on the EHR side, he's helped legions of software developers integrate with EHRs. He's one of those rare individuals who has high technical skills as well as high interpersonal skills. And ladies, he's single. I met Luke while he worked at Epic, acting as an internal VC of sorts. He found the most innovative ideas and helped them scale. Beyond his work on the innovation team, he helped to install some of Epic's largest customers and even found ways to help the EHR giant grow their revenues. There's his little wiggle. And I'm just a guy who's obsessed with solving structural problems in healthcare. I joined Epic for that reason and helped start Redox for the same. We put together a team that has over 35 years of experience developing, implementing, and integrating with the nation's leading EHR vendors. Our board of directors is rounded out by Mark and Jignesh. Mark grew Nordic Consulting to 500 consultants in just under 4 years and has sold to and maintained relationships with nearly all of Epic's customers. Professor Patel is a computer scientist at the University of Wisconsin, and beyond his technical skills, he sold his company to Twitter in 2013. We joined DreamIt at the beginning of the year with $470,000 in funding. Over that time period, we've onboarded 65 application customers to use our suite of developer tools and data models. We're also implementing here at Johns Hopkins as well as other distinguished health systems around the country. We're currently raising $1.6 million to help grow with our customer base. This will help us grow both sides of the network to 500 application customers, 50 health systems to achieve a 7-figure annual recurring revenue by the end of 2016. Our current investors have tracked our progress over this time period and have already invested $750,000. We're building a network that creates immense value. Our vision is to democratize technology adoption in healthcare. When software does not have the integration barriers, the best products will get to market. Redox is the infrastructure necessary to deliver better, higher quality, and safer care, and that's why I got into healthcare. Thank you.